TV. This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome Jill Umbach, who is the coordinator for the Bruce Gray Poverty Task Force United Way of Bruce and Gray. And today we're going to be talking about two very, very important things for our community. Income tax season is upon us, so we're going to be talking about filing income tax and why it's so important, and also income solutions to food insecurity. So certainly that impacts a large proportion of our population. So I'm delighted to learn more about these topics today, and I welcome you, Jill. Thank you for being on the program.
Thank you very much, Carol.
So I know you've got lots to share. Income tax season always gives me the shivers, I have to be honest.
It's a tough one for everybody. We have pulled together some resources for people. We've even, last year, our Community Volunteer Income Tax Network was working on tax preparation checklists, some simple resources and tools, which we now have up on our website. Which is at thepovertytaskforce.com. So we've got a whole page dedicated to the free income tax program, but also other resources that you might use from Prosper Canada and a couple of other links to CRA that helps you in preparing and also knowing what benefits could you get with filing your taxes.
From your experience, are you finding that people are missing the advantage of filing? And what sorts of things and what difference does it make?
Well, we did a study last year in 5 different locations in Grey Bruce, and we found that on average, there was an additional $3,200 per person coming back in. And we actually saw with the people that we surveyed that there was calculating that amount. The program brought in over $1 million back into the community.
Just in Grey Bruce?
Just in Grey Bruce.
Wow.
And that's only with a very small percentage of people actually using this program. But there's a lot that does come back in, and depending on your circumstances, you can get a much higher amount coming in. As I said, the average was around $3,100. But then if you have a family, depending on the number of children, you could be getting quite a good sum back with the child tax benefits paid out through the year. And I think a lot of people resist doing it. A lot of people think, well, maybe I'm not eligible to get some support. I haven't filed in a while. We know that our community volunteer income tax program can go 10 years back. And so you could then get quite a substantial amount of money. The other thing that we're hearing is a lot of people, don't necessarily want to file their taxes, that they're concerned about other things that they might owe the government. We're hearing a lot about people that may still owe the CERB. For people, maybe it was one check that they shouldn't have gotten, or they didn't understand and they slipped through the application process. And only after that, the government came back and tightened things up. So we are seeing quite a few people that are on social assistance, fixed incomes, and suddenly they're having to pay back the government. What we do know is that a lot of the supports will help you call back to the government and negotiate a repayment scheme, or be able to call back to the CRA and say, I simply cannot afford to pay back these lump sum. What do we do next? Yeah. So while a lot of people sort of resist paying the government, I think for a lot of people with lower income, there's a lot more benefits to filing your taxes than avoiding the government. You probably pay out less. than that. Where it gets a bit tricky is when you've got other things that are being garnished from your income. And again, if you're on a fixed income, it's really precarious if any of that clawback happens from the government and payments. So we're always referring people either to the Grey Bruce Community Legal Clinic or to the United Way Financial Literacy Program or social workers at various health centers. And these are all listed on 211, but it's really important to know that there is somebody that could be that person sitting next to you and making that call with CRA and saying, hey, I simply cannot afford to pay back if I owe. But in some cases, I could get a lot more money for filing that would allow me to pay back to the government if I owe anything.
So I'm hearing you say, don't let the fear paralyze you from
Don't
filing.
let the fear paralyze you. There are trained volunteers throughout Grey Bruce who can help you file your taxes this year as well as previous years.
So if I'm a low income or fixed income, and I don't even know if I can pay somebody to help me file,
Exactly.
does this cost? You mentioned the legal clinic and you mentioned volunteers. Does this cost?
All free services. There's no cost to it.
Okay.
So there is not a fee, and it is all free. And with the legal clinic, they can just assist you in talking to the CRA in terms of what's affordable, what you could pay back. So reducing that fear by having someone sit with you and actually support you in that. But more importantly is the fact that you probably are going to get more benefits, and they will be paid out through the year. And it also helps you to understand what are those benefits?
Yeah.
And perhaps you could also be applying to other things. So after you file your taxes, there are other support programs like the Ontario Electricity Support Program that could help reduce your electricity bills. For people that pay rent geared to income or who are in social housing, you need that proof of income to be able to maintain your housing. So it's really, really important that you get the support to be able to file so that you can then maintain your housing.
So from what you're describing, the potential for money to come back by filing, you notice from your study, definitely a gain in Grey Bruce.
Definitely a gain.
That would have not been achieved otherwise. But it also sounds like it's a gateway or a doorway into other services that may also assist you financially. You may never have known about if you didn't go through the filing process. So that certainly sounds like a big advantage, and especially if you have the service free. So no,
Exactly.
It's always hard to have to deal with, government agencies that you have to talk to, and having someone even be there who can help you be the voice, negotiate on your behalf, I think would be a huge advantage as well. What are you hearing back from people who've gone through this process?
So what we've been hearing back in the study last year, we interviewed quite a few people, 10% of the people that were using the program in 2 specific areas. And we heard back from people that, I didn't realize I was eligible for a lot of benefits. We heard back also from people who didn't think they were eligible for the program. A lot of people that were working and considered themselves employed and therefore didn't think they were within the economic levels of eligibility. The program itself also supports newcomers, Indigenous people, people that are a little bit more vulnerable. So there is a bit of a space there. If you are a newcomer and you haven't filed before, they can support you to do that. And if you are looking at, doing it first time, perhaps I heard from a lot of seniors whose spouse had passed. Now, the clinics can't necessarily file for that spouse who has passed, but they could assist you with your taxes that year. So there's a lot of people that I've heard from who never had to file their taxes before. Yeah. And therefore my husband did it, or my wife did it, or I had a nephew always do it and now he can't do it. So when family members can't support you to file, a lot of it too is a literacy piece. Being able to file online is really challenging for people who haven't worked on a computer. A lot of the filing right now is done very quickly, and therefore you get your benefits quickly as well. So it's not, There is still paper mail-ins that can happen. They don't have them at the post office anymore, but you can ask at the post office and get some. But it's a little bit more challenging to do things by paper these days. But if you're somebody who does it by paper, you can bring things in and have somebody who is proficient on the computer to auto file or to file for you on your behalf. So I think that also helps with people. As I said, tax preparation lists, many of the clinics will let you know, here's what you need to bring. Here's what I can see. And then if things like not having rental receipts are a challenge, the legal clinic can help you negotiate with your landlord around what is a receipt that you could use for tax purposes. So there's a lot of partnerships that are happening around where it's like, if this is a struggle, this is where we can help you. In many cases, if you have a fairly straightforward tax filing, volunteers can do an autofill from your CRA account, and it goes very quickly. And so maybe you don't have all the documents in the mail coming to you, but the My CRA account will have any of those documents. So we do encourage families and also people that are working. We know there's a lot of people working full-time with a minimum wage job. They're not receiving, a living wage or higher. They're generally eligible to use the program as well.
Wow. So someone listening, wondering how to even start, who do they call? How do they make that first step?
So the first step is you can call 211.
Yeah.
And they have a listing for all of the clinics and or services being offered. Some of the clinics are only offered during tax time. Some of them are drop-ins. Some of them are by appointment. Some of them are drop off your information and have it done and then pick up. So we have a variety of ways that the program is rolled out. We also have a list on 211 of who's available throughout the year. So it may be that at a tax clinic today, you filed just for this year, but then you can make an appointment with someone who could go and do your back taxes.
Wow.
In some cases that may be decided that you have to file earlier. But again, it's all subject to engagement with the CRA and what it says. In some cases as well, if seniors are having a challenge to say, I don't remember my password, I can't get in, I've been locked out. These are things that certain coordinators of programs can go into your My CRA account with all the confidentiality agreements signed with you. They can go in and actually check things out. So what's happening with your account? And so sometimes it's challenging to get on the phone and wait to try and get assistance. Another really good place to go to is MP Alex Ruff's office. They can engage with CRA working with you as well if you run into issues with regards to, I can't get my information, or I'm struggling, I'm locked out, or where do I go? They can also triage on more complex cases and have direct links to CRA. But call 211. We also have an online listing called freetaxclinics.ca. And that link will take you directly to the 211 listing. You can also go on to canada.ca and also they will take you to free income tax programs. But we've done it a little bit more customized on 211 to make sure that both individuals and families and households know about it, but also our social agencies can also quickly access for the area.
Excellent. My dog is barking in the background, so sorry if you can hear him. He's on, I think, the post-delivery alert. So let's move on now and talk about income solutions to food insecurity. What would you like to share with us today about that, Jill?
Well, the Grey Bruce Public Health has just released their annual report on food affordability. And within that report, they speak to the actual costing of what food is costing in Grey Bruce. A family of four needs at least $1,305 each month for food. And this is just food. And then they talk about as well all the other costs that come into play. the housing costs, transportation costs, and other basic needs. So what we are doing is in supporting the release of that food availability report, we are speaking to the issue around hunger versus food insecurity. And there's quite a difference. So having food insecurity does not necessarily mean not having enough food. What it also means is you don't have enough income for food. So hunger is something that is pretty normal with all of us. We can experience it on a chronic basis, or we can experience it every so often. And hunger can be met by a lot of the community organizations that can provide extra food, or we prioritize food. But a lot of the time when it comes to not having enough money to purchase food, we opt to skip meals. We opt to compromise on the quality of food. You know, you buy the cheapest stuff. We skip meals in order to have other members of the family eat, or we eat less when we don't have enough money. So it's one of those flexible things that goes first. And we know that it has significant impact on your health. Food insecurity, on the other hand, results from policy choices that lead to poverty. So solutions focus on income means having enough income to be able to purchase food. But it also means having enough income to pay for your housing, to pay for your transportation, and having a job that pays well enough. So we do promote the living wage every year. And we know it's going up year to year as the cost of living is going up. We know that jobs don't necessarily provide enough. Some jobs don't have enough with benefits. So a good job with benefits, a job above a living wage, filing your taxes so you get those additional benefits throughout the year for low-income households, and is something that we were promoting. We'd like to see some of the automatic tax filing happen in the future, where people are who may not have the supports or the financial savvy to file all their own taxes. If you're on a low income, it gets done automatically. And we certainly see the need for increasing social support. So Ontario Works and ODSP. We've seen an increase recently last year on ODSP, but it's still simply not enough to be able to afford housing, rent, and ultimately it's not enough to purchase healthy food.
Are you seeing an increase in the gap relating to the affordability over the, we
definitely.
Okay. Speak more.
Yeah, one of the biggest issues we've had, and we have a lot of data that supports that, is that we still have about 17.5% of Grey Bruce County struggling to afford food. And what our community meal programs, such as OShare and others, are seeing is that we saw a spike in the need for delivery of community meal program in 2020 with COVID, with the pandemic starting. And we have, throughout the pandemic, we were able to draw upon resources in the community. We had large grants coming from the federal government and the provincial government. There was a sense of everyone's staying home. We need to feed everybody. So there was a buildup of capacity in terms of people responding. Programs that had never provided meals before were providing meals and frozen meals and delivery and everything. And the numbers since 2020, skyrocketed in 2022 all the way up and kept going and going. And now in 2024, they have not come down. In fact, we're still at the high pandemic levels for a need. And what food banks and community meal programs are saying is that we're seeing new people. So people that were in the moderate to middle class incomes are now tapping into food banks and community meal programs. So there's new faces, as well as everyone that's been going on a regular daily basis. And so that's a huge, huge change. It's getting worse, not better, because of the lack of resources. So there's only so much that the nonprofits and the charities can do to fundraise in the community. And so there really does need to be a political change. There needs to be something that comes from the province, the federal government with their national food policy program. We need to see more money coming through if we're going to ensure people are fed. And of course, we also see that people need more income. We know that local businesses are struggling to pay out and they're struggling with their profits, but it's something that has to look at the whole system around affordability. The other thing we are seeing is a significant increase in school programs requiring lunches. So there is requests that have gone to OSHARE to provide and support lunch programs. And more parents are asking their children to be put onto a free lunch program. That is something that was in the national food policy as a target for the federal government. And we haven't seen anything come down on that. But what we do know is that our nonprofits are struggling to raise the funds to be able to feed kids in school now, as well as feed the people that come to the programs.
You said earlier, 17.5% of Grey Bruce does not have enough to eat.
They struggle to afford food on a monthly basis.
That's a huge statistic. And what I'm hearing from you, we're discussing the school program, is there's an impact from youth to, I'm assuming, seniors who may be on fixed income.
Yeah.
So this affects every single face in our community in different ways. So you're mentioning almost a whole community system of response to food insecurity, and that could be political, could be a variety, but it is not one agency, not one food provider, not one service support agency. It has to be a whole community working together.
Yeah, and I think to be really clear, all that our community does in order to feed people,
yes,
we are only addressing hunger. We are not addressing food insecurity.
Right, because that's
income. Exactly. So it's the income solutions that are going to need to be there in order to ensure a household and a family or an isolated senior is food secure. Their ability to be able to purchase healthy food is very different than our ability to feed them on an ongoing basis. And really, we need to turn it around and say, why can't this person afford food?
Yes.
And at the same time, we need to meet their need to their basic need to be eating, to stop being hungry. We don't want hungry people in our community, of course.
Yeah.
And our nonprofits and our charities are doing incredible work. I mean, we galvanized everybody together. It was a huge pull together in 2020. And as I said, places that had never served meals suddenly, saw the need and opened the doors, and people were serving meals. But at some point in time, as the money is no longer flowing to these organizations, we're hearing reports that, the freezers used to be full of frozen meals and delivered out to isolated seniors, and now the freezers are empty. We do use Food Rescue, which is a program by Second Harvest, which diverts foods from grocery stores, and it's expanded from just being in Owen Sound. We have it all the way from Dundalk to Tobermory. And so we've expanded that program as much as we can, and it's based on volunteers receiving food, cleaning it up, sorting it, and turning it into meals. But it's still on the backs of volunteers. It's still on the charitable sector to try and do that. So there is something critically wrong when it's all the volunteers doing this work and staff, very few staff with our charities. And there's just something wrong with the system right now, that our food system is not providing enough for people. And so what's missing is that really people don't have enough income to purchase. It may be that it's the cost of food that's going up, and that needs to change. But I think ultimately we need to find a balance between the rising costs of food, versus people's ability to purchase food.
Yes.
And so we do look at things like a guaranteed basic income. We look at paying a living wage. Like, what is it that we can do to increase income for people? And at the same time, what is the government doing around policies around the cost of food and the production of food? We also don't want to, we also recognize that in our area, we have a lot of farmers as well. They've got to make a living producing food too. Yeah. So it really does take a holistic look on the framework of our food system. Yeah. And unfortunately, food banks and community meal programs have become an integral part of feeding people.
Yes.
And we need to have that larger policy discussion.
I may be going out on the end of a branch, on the end of a twig here, but I have heard that when people can't afford their rent, or they have to make a choice, you
yes.
pay your rent to keep a roof over your head, their only option is to start accessing food banks or meal services. That in some ways, the food that's being provided through the organizations is actually keeping roofs over the heads of people in our community. Have I got that right?
That's definitely true. I mean, people, as I said, you must, one of the first things to keep your housing is to pay your rent. Or to pay your mortgage if you're fortunate to have that. And we are seeing people in those circumstances as well who have mortgages that are going into the food bank or into community meal programs. Mm-hmm. I think what we have to recognize is that's emergency food. Yes. That's for an emergency. That shouldn't become your daily life. And for many, that is the only way they can afford it. The only way that they can eat well. Is to do that. And there's nothing wrong with that. When you're in those circumstances, reach out. We also have a listing on 211 for all the food banks and community meal programs across the 2 counties. And it's really important. We also have a listing for things like the Good Food Box, which offers a large fruits and vegetables, healthy fruits and vegetables for $22 a box per month. And it's usually enough food to support for 2 weeks. And so again, trying to get that out to people is critical. We don't want people's health in any way to suffer. And we want to support people staying housed. Our challenge with the larger federal government and provincial policies is that it's not just one thing. There needs to be a holistic approach to how do we keep a family, a household, an individual, an isolated senior? How do we keep, maintain their well-being? Yeah. And a lot of that is we need to look at income solutions first to then try and address the food insecurity at the same time providing food to meet the hunger.
Yeah. I can't believe our time is up. It is always a pleasure speaking with you. This is a critical issue in our community that definitely is increasing, and you certainly can mention and have mentioned the word emergency. It's a crisis in our community statistically. We are also not talking about luxuries. We're talking about basic survival needs of a roof over your head and food in your stomach. So certainly, Jill, thank you for being on the program today. And please come back again and update us on how things are going.
Definitely. Thank you, Carol.
Thank you. Thank you to our viewing audience as well for joining us today on HealthLink. Please tune in again for more information on programs, services, and resources available to you and to your family. Take care and stay safe.
Connect with us by visiting our website or email us at comments@rogerstv.com.
on Rogers TV.
D-Day has finally arrived. The deadline is here.
It's NHL trade season, and Sportsnet is here for it with the NHL's most comprehensive coverage.
That's a team that's trying to win.